Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Swallowing Quality of Life questionnaire assesses the impact of dysphagia on a patient's daily life. It evaluates physical, emotional, and social aspects related to swallowing difficulties. The tool measures domains such as burden, eating duration, fear, mental health, and social functioning. Its main purpose is to provide a standardized method to quantify swallowing-related quality of life in patients with conditions like stroke, head and neck cancer, and neurodegenerative diseases. The questionnaire aids clinicians in identifying the severity of dysphagia's effects and monitoring treatment outcomes. The Swallowing Quality of Life questionnaire is indicated for adult patients experiencing oropharyngeal dysphagia, particularly those with neurological disorders, head and neck cancer, or stroke-related swallowing impairments. It is most useful in clinical settings, focused on assessing the impact of dysphagia on patients' health-related quality of life. The instrument evaluates multidimensional aspects, including symptom frequency, mental health, social functioning, and eating duration. It aids clinicians in identifying specific areas of swallowing-related disability and monitoring treatment outcomes over time. Validity and reliability have been established across diverse patient populations with impaired swallowing function. The Swallowing Quality of Life questionnaire consists of 44 items designed to assess the impact of swallowing difficulties on daily functioning and well-being. It includes 10 domains, such as burden, eating duration, eating desire, symptom frequency, food selection, communication, fear, mental health, social functioning, and fatigue. Each item utilizes a 5-point Likert scale response format, ranging from never to always or no difficulty to severe difficulty, depending on the question type. The administration involves instructing the patient to respond based on their experiences over the past month. Scoring requires summing item responses within each domain and transforming them to a 0 to 100 scale, where higher scores indicate better swallowing-related quality of life. Reference values suggest that scores above 75 reflect good quality of life, while scores below 50 indicate significant impairment. Clinicians should interpret domain scores individually to identify specific areas of concern and guide targeted interventions. The sensitivity of a diagnostic tool refers to its ability to correctly identify individuals who have a particular condition, while specificity denotes its capacity to correctly exclude those who do not have the condition. In the context of the Swallowing Quality of Life questionnaire, sensitivity indicates how effectively the instrument detects patients experiencing significant swallowing difficulties. Specificity reflects the questionnaires' ability to recognize patients without such impairments. Studies evaluating the Swallowing Quality of Life questionnaire have reported sensitivity values ranging from 0.7 to 0.85 and specificity values between 0.7 and 0.9. For example, if the questionnaire has a sensitivity of 0.8, it correctly identifies 80% of patients with dysphagia. A specificity of 0.85 means it accurately rules out 85% of patients without this condition. These metrics demonstrate that the questionnaire can reliably discriminate between affected and unaffected patients, thereby aiding clinical decisions related to swallowing dysfunction. Developed in the late 1990s by McHorney and colleagues, the Swallowing Quality of Life questionnaire was designed to assess the impact of oropharyngeal dysphagia on patients' daily functioning and well-being. Validation studies conducted during the early 2000s demonstrated strong psychometric properties, including high internal consistency with Cronbach's alpha values exceeding 0.9 across multiple domains. The instrument exhibited excellent test-retest reliability, with intra-class correlation coefficients above 0.8, indicating stable responses over time. Convergent validity was established through significant correlations between the questionnaire scores and objective clinical measures of swallowing function, such as video fluoroscopic evaluation and clinician-rated scales. Subsequent research involving diverse patient populations, including those with neurological disorders and head and neck cancer, corroborated the sensitivity of the questionnaire to detect changes in quality of life following therapeutic interventions. Factor analyses supported the dimensional structure initially proposed by the developers, reinforcing the construct validity of the tool. Collectively, these validation efforts provide robust scientific support for the use of the swallowing quality of life questionnaire as a reliable and valid patient-reported outcome measure in dysphagia research and clinical practice. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.